Hi, my name is Dr. Karan Shetty. Welcome to my YouTube channel. Please like and subscribe for more educational content on plastic surgery and dermatology.
The first reaction when you saw real surgery, like what was your first reaction?
First reaction when I saw surgery, it seemed like a lot of fun. It never felt difficult or disgusting or something that you shouldn't do. It's not something that I learned to love. It was something that it seemed cool from the beginning.
It's okay, don't use the wildest request a patient has asked you to do.
Yeah, we get pretty wild requests. But I think wildest request has been, I had one guy who came to me who wanted us to cut his face from here to here and stitch it badly. So you basically wanted a scar in his entire face. I
Is
think
he a
that
cosplayer or something?
I have no idea what he is. Those are so we get weird requests in the sense India is still it is not Germany, it is not Japan, it is not America, where the fringe society hasn't developed too much. So you see fringe, where the fringe society or the acceptability of what is not normal is very high in societies like that, where you're allowed to be who you want to be with pride. And I think that's where you get a lot of weird requests. India kind of still stays within a certain normalcy, but yeah, things like this where cut my face up badly and stitch it badly.
Is there like a particular celebrity people say they want you to make them look
Yes, so many. We especially when it comes to Iranian girls who we do rhinoplasties for, they show a lot of their of the Kardashians or Kylie Jenner or all those people. Indians usually with the nose, it's Janvi Kapoor or mainly Janvi Kapoor. I think Deepika to a certain extent, but yeah, those are the most common. This one.
Did anyone ever ask you for a face-off surgery?
Yeah. I mean, I think as a joke they did, as a face off. Then I think most people know you can't do that. But yeah, that movie was very interesting. This guy called John Woo directed. Yeah.
Okay, what is the maximum number of surgeries one of your patients might have gotten for just one particular area? Like for the face?
Yeah, usually it's the nose. Because what happens is they go somewhere, they don't do their research, and then they kind of get it botched. And then they are now desperate. Because usually you need to wait for at least 6 months before you go in for the next one. And then they go to someone else, and then they botch it again, or it's difficult to correct it, and then they go again to someone, and then now it's in a position where everything is jumbled up, and this one, then you need to take a rib and correct. It's basically then starts becoming a reconstructive procedure rather than a cosmetic procedure to improve. So the nose, I've seen people who have done nose for the 4th time. I know in America there are people who have done multiple times, but I think our maximum has been about 4.
Generally, most number of procedures in general?
Yeah, usually what happens is some people do have mild body dysmorphia, and then we've had someone who was before her marriage did her nose and her chin, and then she had children, and then did her breast and her abdomen, and then she put on a little weight and did her inner thighs. But I think that was a progression, natural progression. It didn't seem like she wanted too many things at one time. But I think 4 to 5 procedures we have done on one person.
How do you relax or de-stress after a long day?
I used to work out a lot, and then I had a neck injury, because of which in the last 2-3 months I haven't worked out, and then I restarted a couple of weeks back. So I think working out really helps. I've always been a big movie guy, so I think we've always, since childhood, we've been watching everything. I've been watching anime since like 15-20 years, watching English in this one, and then a little bit of Korean now, mainly thrillers and all of that. So I think movies and workout, simple things.
If you could change one thing about the plastic surgery industry, what would it be?
I think regulations in plastic surgery. People, it sometimes now it's people think it's easy to do certain things. Like you will not find a person who's not a neurosurgeon doing a neurosurgery, but you will find someone who's not uh, a plastic surgeon or is not qualified to do, say, a liposuction or a particular procedure, trying to do that procedure. So the biggest problem in plastic surgery and in dermatology as well, I know dermatologists have a hard time too, because in dermatology it's even more rampant, where people who are just MBBS, BDS, even non-doctors, uh, Ayurvedic, this one, try to get into that aesthetic industry because they think it is lucrative. But the real answer is that you have to be educated in a particular thing, because it's not when something goes right that you take the credit for it. You learn for things that go wrong. So when complications happen, how do you handle the complications? That's only if you have gone through the entire thing.